Many patients are seeking out male enhancement. For example, they want an enlarged penile shaft and penile glands. However, there's a question about those who are not circumcised, for example, and they say, hey, does it matter if I'm circumcised or not? And it actually does. For example, I recommend patients to get a circumcision prior, and there's a reason for that. Let's assume, for example, let's say here's the glands of the shaft, and this is the penile shaft here, penile glands. The area that has that foreskin, let's say you're not circumcised, that foreskin area is very wide, and the skin is a little fragile. So when we fill this area, let's say we did a shaft and glands, you did not want to get circumcised, which is fine. However, what would happen is we'd put filler all the way up to a certain point, and then not put filler in a certain area, okay? So what's the conclusion? What's the result? You'll have an enlarged shaft, but it would narrow down a little bit more at the top, right? Because we couldn't put much filler there because the skin is very sensitive. Now, 40% of patients who are not circumcised say, hey, that's fine, everything functions well. But 60% say, you know what, I want this area to be balanced. So then we would do the circumcision after the fact. So you do have a choice. You can get a circumcision prior, right? Or you can get a circumcision, if needed, after the fact. And that's basically how we handle those who are uncircumcised.